Hi everyone, today I am going to talk about IoT in diabetic devices. So as you all know, IoT stands for Internet of Things. And so just to give an overview of why IoT is so important in diabetic devices. So being diabetic, it's pretty much a part-time job. You have to record your glucose readings 3 times a day. You have to take your take a drop of blood, put it on the test strip, put it into the glucose meter, and from that, figure out how much insulin to give yourself. And all of this actually has to be recorded for the doctor, so the doctor knows what's going on. But most of the time, patients don't do this accurately, and it becomes a struggle for the doctor to really adjust the patient's regimen and give them the best patient care. And so Internet of Things, it's really the future of diabetic devices, especially for chronic state diabetic patients. And some of the devices that can be connected are continuous glucose monitors, glucose machines, insulin pumps, and the device will actually be hooked up either through the internet or Bluetooth and transmit all that data onto the patient's phone. And so the goal of this is pretty much to improve patient safety, improve quality of life, and medication compliance. So these are just pictures of IoT and diabetic devices. As you can see, the picture shows the diabetic devices being hooked up and the data transmitted onto the patient's phones. So I just want to give you an example of a diabetic emergency scenario and how IoT is going to be very beneficial for the future diabetic population. So ML is a 62-year-old woman who lives alone and is type 2 diabetic. During her sleep, she becomes very hypoglycemic, and which means she can die. And so her continuous glucose monitor, which has IoT, it's hooked up to IoT, sends her an alert on her phone to wake her up. However, she is so hypoglycemic, she's in a coma and she can't wake up. And so the alert or the device sends an alert to first responders and alerts them about ML's current condition. And through IoT, the first responders can access her EHR, know her current blood sugar levels, and arrive to her house and bring her to the ER. And so ML is saved through Internet of Things. And so although this may seem like a very extreme case, it's actually not. Many diabetic patients die from hypoglycemia, and it's actually a very big concern in healthcare. So, Internet of Things, diabetic devices improve patient outcomes. So, through research and clinical trials, which are cited at the end of my presentation, it shows that Internet of Things and devices improve drug adherence. And so, a big problem with diabetes, it's a chronic state, which means the patient will have it for the rest of their life. And so, it's hard because when patients don't adhere or comply to their medication, it actually will make the disease progress more, and which leads to very bad outcomes. So one company, Proteus, designed a tiny ingestible sensor which can record medication info and transmit that information onto a patient's phone through Bluetooth. And so what that is, it's a small chip inside a pill. So for example, metformin, they'll put that chip into the metformin, and so when the patient takes it, they'll actually ingest it, and that little chip will be in the body for a couple of days and just come out. But while it's in the patient's body, it actually records bioavailability, how much of the pill gets absorbed. If the patient misses their pill, if they take double, it'll actually record all the compliance, and it will actually send alerts to the patient's phone to remind them if they missed a pill. And so as the patient is taking each pill, these sensors will actually have a ongoing record of what's going on inside the patient, And this actually makes it very easy for the healthcare provider, such as a doctor, to know what's going on with the patient, why this pill isn't working, how they should change their medication regimen, and it really makes control of the disease state a lot easier. And it also makes patients feel engaged with their treatment regimen. So IoT is being integrated into EHR systems. So an upside of it is that it gives the provider a holistic view of what's going on with the patient. It makes billing and insurance a lot easier because it's an accurate record of what's going on, and cost benefit analysis. So it actually will improve patient and clinical outcomes, which actually will prevent the disease state from progressing. And which is good because when diabetes progresses, it will lead to lots of problems such as dialysis, losing your vision, nerve pain, cardiovascular disease, which will actually, in the long run, be more money for the patient and the US healthcare system. And there are concerns such as issues with HIPAA and cyber attacks, but yet again, these are ongoing problems in all of healthcare, and with the right security, with the right protection, and being careful with patient protection, IoT should not be a problem for the future of diabetic devices.